I'm excited about this topic. It's one that we have name dropped time and time again.
This is one of the only drugs in dermatology that can actually cure acne, not just manage it.
Ooh.
Why your skin gets worse before it gets better, the disastrous and sexist rollout of Accutane's required program, and whether or not it's safe for you to use. First, I want to talk about the crazy history of Accutane.
What is that?
Well, you were taking abstinence at the time.
I was. I said, no, this is not that. I am abstinent. I've taken a pledge. So wild.
I know.
Hello, and welcome back to another episode of Beauty by the Beaker. I'm Natalie.
And I'm Sadie.
And we are back. It's Wednesday, it's a science salon, and
we're two cosmetic chemists, and we're here to give science a hot new makeover. And we're still working on that intro a little bit.
Yeah, we'll refine it in time.
It's a work in progress.
Hey, if you have notes, let us know. How would you intro this episode?
I want to go back and watch our old intros to see how we did it then.
Yeah. Do you think we're better or worse?
I don't know. Jury's out. Really
let us know. What intros do you guys like? What do you think we need to be saying? What would make you feel more inclined to listen to this episode?
That's good. Yeah. I'll do an Instagram poll.
Anyway, we have much to cover today. And I'm excited about this topic because it's one that we have name dropped time and time again. It's about time it gets its full episode.
Yeah, if you've listened to like 5 minutes of any episode of our podcast, you've probably heard us name drop today's topic.
Mm-hmm.
Does anyone have a guess? Write your guess in the comments.
Who could it be?
Wow.
Who's that oral cosmetic drug?
Accutane! Today's episode is all about Accutane because most people know Accutane by name. Like I said, if you've listened to any episode of our podcast, you know who she is.
Yeah.
But you probably don't understand how it actually works. This is one of the only drugs in dermatology that can actually cure acne, not just manage it. Sometimes. I'll explain why it's sometimes. So in today's episode, we're covering the accidental discovery of a cure for acne, why your skin gets worse before it gets better, the disastrous and sexist rollout of Accutane's required program, and whether or not it's safe for you to use. Accutane is actually not a name that we use anymore. The drug itself is called Isotretinoin, but Accutane was like the first trade name that was popularized. So it's just what we refer to it as because everybody knows it as Accutane, but it's actually called Isotretinoin. So
kind of like Tylenol.
Yes.
And acetaminophen.
Yep, it's the same sort of situation. So if I go back and forth between Accutane and Isotretinoin in this episode, they're the same exact thing.
Yeah, and I'm excited about this because both Sadie and I have done Accutane. I did it before the development of my frontal lobe. So did you.
Oh, yeah.
Right? Technically.
Yeah. So we're already seeing its negative effects.
I did it when I was like 19, I think.
I did it when I was 23, I think. So, yeah, we'll talk about...
Sadie did it when my frontal lobe was developed.
Yeah, you're welcome. Yeah, Nat was around for my entire Accutane journey.
I was.
So she might have some thoughts. I wasn't born yet when Nat was on hers. Okay, so first, before we chat about Accutane, we obviously have to talk a little bit about acne.
Obviously.
We have 2 full episodes. Do we have 2 episodes on acne or just 1?
We have 2-ish because we have the non-comedogenic.
True.
Yeah.
Yep.
We've covered it here and there in great detail and lesser detail.
Yeah, we love to talk about acne. We'll link whatever episodes we have down below.
Yeah.
Also, if I say that in the episode, I love saying that in the episode because it just gives you more work to do. Hey, we're going to link this. Hey, we'll put this up here. Hey,
I try to do them all. Sometimes it's 11 p.m. and I'm like, I don't remember where that drop was.
Curse you, Sadie. Well, either way, we have hair follicles all over our bodies. And inside these follicles, we have little glands called sebaceous glands. And they squeeze out an oily substance that's called sebum.
Was squeeze the verb that was necessary to use?
No, I added that in for you. All
right.
And actually, I think it said secrete. But I'm trying to simplify things and make them less uncomfortable.
Well, you're doing it.
You're welcome. We'll keep squeeze.
Okay.
This sebum is what keeps our skin from drying out. And we also have hormones called androgens, and these are what trigger our sebaceous glands to make them secrete, you're welcome, the sebum. Sometimes these androgens can tell the skin to secrete too much of the sebum, and the excess sebum has nowhere to go, and the skin cells lining the inside of your hair follicle don't shed the way that they're supposed to. And so instead of sloughing off normally, lots of good adjectives in
slough.
here.
Yeah. No, I love a slough.
Yeah. Big sloughing fans over here.
I've been trying to improve my slough myself, actually.
Yeah, how's your slough going?
It's good. Yeah,
Really?
I noticed the slough happening.
It's kind of incredible once you get into the slough.
Yeah, I look 30 years younger.
She looks like a newborn. Anyway, instead of sloughing off normally, they'll stick together and they'll pile up. And this is called follicular hyperkeratinization. Okay? I won't say that again. Don't worry. That buildup of dead skin cells and excess sebum forms a little plug inside the follicle. And that plug is what we call a comedone, or your whiteheads and blackheads. Basically, your body secretes too much oil. Oil builds up inside of your hair follicle, it gets all plugged up, and then it creates a whitehead or a zit.
Yeah.
That's essentially how acne works. So Accutane is an oral medication that's derived from vitamin A or retinoid, and that's used to treat severe acne. It's usually used as a last resort for stubborn acne that won't go away with topicals or other oral medications like antibiotics. And I'll talk about the actual mechanism of how Accutane helps acne a little bit later, but first I want to talk about the crazy history of Accutane.
Yeah, I'm interested.
It was first created in 1962 by Hoffman LaRoche, and it was patented in 1969. It was originally intended to be a preventative for skin cancer, but in 1970, Gary Peck, who was an investigator at the National Institute of Health, or NIH, their dermatology branch, he discovered that it was an effective treatment for severe acne. So basically, he started at the company's dermatology branch in 1969, and he was intending to research newborn rat skin, but then someone was already studying it, which I literally hate when that happens.
Ugh.
You find something you're so passionate about, someone else already
has
found it.
Ugh.
So instead, he was like, okay, fine, I'm going to find something else to study. And he spent 6 months diving into literature archives, and he found a study that showed if you add vitamin A or retinol to embryonic chicken skin, which is chicken skin from an embryo, so it's not fully developed yet. If you add vitamin A to that in a petri dish, you can change what the skin becomes.
Oh.
So the normal process is that the skin produces keratin, which is the tough outer protective layer. But
Right.
instead, when you add retinol, it switches tracks and turned into mucus producing tissue instead, which is gross. But it's interesting because it showed that vitamin A has the power to change how skin cells develop and what type of cell it actually becomes.
Yeah.
So he was like, screw the newborn rat skin. We have something
chicken
here.
embryos.
Then in
Let's get an
1970,
animal before it's born.
seriously. Yeah, kind of sad.
Yeah. Unfortunately, a lot of the background of these things is very sad. But it's better to use this information to go forward than to repeat it.
100%.
Or create issues that could have been prevented had we looked at this research.
Yes.
So
Yeah, it's very good foundational research for everything that we could do now.
But cosmetic chemists don't do this kind of thing now. I mean, some of them probably do.
I never have.
But yeah, mainstream cosmetic chemistry does rely a lot on previous studies, and current animal testing is not very common.
Yep, especially in the US. In 1977, Peck began a double-blind placebo study that tested isotretinoin in treatment-resistant acne, which is just acne that, like, no topicals helped it, nothing helped it go away. And as a reminder, a double-blind placebo study is the best kind you can do. It means that they're comparing the active ingredient against a placebo, which is the same exact thing. It just doesn't have whatever you're testing in it. And the double-blind part means that the patients and the people who are testing it don't know who's part of whichever group. So it just removes any bias that you could have in the study. However, the thing with this study is that some of the patients started getting chapped lips, which proved they were on the medication. So the double blind part was broken around the 4-week mark. But fortunately, they were already seeing significant differences between the acne with the two groups. And so after the study was complete, most of the patients were either eventually cured of their cystic acne or had long-term remissions without continuing therapy, which means they had a really long time where they didn't have acne.
Yeah.
So yeah, it worked so well that they couldn't even continue the double blind part because they were like, well,
It's pretty obvious.
yeah, you have chapped lips and you have no acne anymore. So
Yeah.
clearly you're part of the drug group.
Which I can verify.
Oh, yeah.
By the time you like get all the oil sucked completely dry from your face, you will have chapped lips, but also the acne will be gone.
Yes. Yeah, it's exactly what's going to happen to you. And also you're going to have no liquid anywhere else in your body.
Yeah.
Say goodbye to your joint synovial fluid.
Yeah. Oh no. Yeah, one thing I used to say all the time is that you can't have acne if you don't have skin.
Yes.
So
yeah,
I think that's part of the MO here.
Yeah, there's like a proposed mechanism for how it works, but I think it's really just removing several layers of your skin and then there's nothing else for your acne to be in.
Yeah, exactly.
So thanks to Peck's study, the FDA approved isotretinoin under the trade name Accutane in 1982 for treating severe nodular acne that is resistant to other types of medications. And since then, we've seen fewer cases of severe acne because people are getting treated with isotretinoin earlier. So the rates have gone down because it doesn't have to get to that point anymore.
Yeah.
Which is really nice.
Yeah. Yeah. I was going to say, I was prescribed Accutane pretty early on in my, probably much earlier than other people. I feel like I tried exactly 0 other treatments beforehand, but it does seem like maybe they're getting a little loosey-goosey with those prescriptions.
I was just going to say, both of our derms are very loosey-goosey in different ways. But yeah, the second I asked for Accutane, my derm was like, yeah, I've like been waiting for you to ask to get on this. Why are we trying other things? Oh, okay.
Yeah, it does seem to be, all my brothers did it as well. Maybe, I think all of them. But it's definitely accessible.
Yes.
Here.
Much more accessible than it used to be, yeah. And in 2002, the patent expired. So the patent for Accutane specifically expired. So generic versions started coming out, which is why it isn't called Accutane anymore. It's called isotretinoin, or there are a bunch of other different names that it's under. But because it was called Accutane for so many years, and that was the original form of it, people continue referring to isotretinoin as Accutane. It's like the most popular way to say it.
Yeah.
Most popular thing to call it.
Accutane itself does not exist, right?
No.
Like they stopped producing Accutane.
Yeah. Yes.
I think it'll be similar with like Band-Aids. Like even after, if ever, Band-Aid goes out of business and they stop making their adhesive bandages, we're probably going to still call all adhesive bandages Band-Aids.
Yep.
Because that's just become like the word for it.
Yeah,
kind
of same with Kleenex.
Yeah.
Like you can still call them tissues, but
yeah, or tissues.
Who the hell is calling them that?
There's no H.
Oh, that's true. So do you say it's issues? Oh, I have issues.
Latest issue.
And you might be asking yourself, how does Accutane actually work?
I am asking myself.
We don't know the actual way that Accutane works, but here's the universally accepted way. So remember how acne basically starts by your oil glands producing too much sebum, they clog the pore, and then it leads to pimples. Accutane works by drying out these glands so they can't produce excess oil anymore, and it stops this whole process, therefore curing or heavily reducing acne. And we have chatted about retinoids in 2 different episodes. You should go listen to them. They're great. But essentially, retinoids work by binding to and then activating our nuclear retinoid receptors. So this works like a lock and key. The receptor we have is like the lock, and then the retinoid acts as a key that opens it. And then once it turns the lock, it switches certain genes on or off. That's how tretinoin, which is the topical version of vitamin A, works. It binds to its receptor, remember the key in the lock, and then the receptor activates, the genes change, and the skin cells turn over faster. So Accutane should work the same way because it's in the same family. It's still vitamin A. But strangely enough, when researchers tested it in a lab, they found that isotretinoin barely binds binds to those receptors at all. So scientists were stumped. They were like, how is this so effective at shutting down the sebaceous glands if it's not even doing the thing that retinoids are supposed to do? And they found that isotretinoin is essentially a disguise. It's what's called a prodrug, which I had never heard of before this, but I'm sure you have.
Yeah.
It basically means that it's not the active form of a molecule. So when tretinoin gets inside a sebaceous gland cell specifically, the cell turns it into tretinoin, or retin A, which is the active form that our body can use. If you'll remember from our retinoid episode. This whole thing is like kind of confusing, but if you listen to that episode first, it'll hopefully make a little bit more sense. But that converted tretinoin then binds to the receptors and does the work. So the isotretinoin or Accutane isn't acting directly. It just gets delivered to your sebaceous glands and then it converts from there.
Yeah.
Is that a good explanation of a prodrug?
Yeah. It's like, you know how like if you buy an electronic, there's always a little tab in it that you have to pull out?
Yeah.
I feel like that's kind of isotretinoin. It's like the before. You get the product.
Yeah.
But in order to actually make it work, you have to like break the little tab off.
Yeah.
It's kind of like that.
Yeah, that makes sense.
It's necessary for stability to have that little piece on there. But then you have the equipment to remove it once the product is delivered to the correct address.
Yes. Yeah, definitely.
So,
yeah, it's kind of like just like a little delivery driver.
Yeah, it's do not remove this tag under penalty of law except by customer.
Probably what it says on the Accutane package too.
Yeah.
The 10,000 pages.
On the bond.
Yeah, literally.
It's like, do not break this bond until I get to my retinoic acid receptor.
And your
location.
body, your cells read that and they're like, okay.
Fine.
Make your way over the sebaceous gland.
Here you are.
Yeah. This matters because the conversion appears to only happen inside the sebaceous gland cells, which is probably a big part of why it targets them so precisely when other retinoids don't have the same effect. There are some other possible mechanisms that researchers are studying, but this is the best explanation we have as of right now. And you might be asking yourself, Sadie, this drug was approved almost 50 years ago. Why the hell don't we have an actual explanation for how it actually works? And the answer is probably because it works so well and was released so quickly for clinical use. There isn't that much incentive to figure out how it actually works. It's like, okay, we know that this works and is so effective. Why would we spend a bunch of money to prove what we already know?
Yeah.
And that's the same case with retinoids in general, like tretinoin and stuff.
Yeah.
We still don't fully know how those work, but why would we pour a bunch of research and money into it when we know it works?
Like the anecdotal evidence is so high that at some point it does kind of outweigh sound scientific understanding of the mechanism. It's like kind of the way that like all of us benefit from gravity, even if we don't understand exactly how it works. I don't know.
Yeah, sometimes, like you said, the anecdotal evidence is so strong that it's like, that's enough.
Yeah.
And you know what? It's enough for me.
Yeah.
So I think that explanation makes sense to me and I feel fine with it.
Yeah.
Like, yeah, it just targets my sebaceous glands. And you know
That's
what? As long as you do whatever you need to do, that's all I care about. As long as you shrink those little suckers.
Yeah. My skin looks better for it.
Yeah,
so.
exactly. Now that we understand how Accutane works, let's chat about the actual process of getting onto Accutane. Because my goal with this episode is to give you information about Accutane and also maybe if you have a little bit of anxiety about it, kind of assuage those fears a little bit.
Yeah.
So Accutane has to be prescribed by a dermatologist. It is a drug. Typically, you'll go to your derm.
Prescription drug. Sorry.
It's a prescription drug, yes, not an OTC. Typically, you'll go to your derm and then they'll usually put you on less intense therapies first, like antibiotics, topical tretinoin or spironolactone. And if those don't work, they'll bump you up to Accutane. If you're not derm, you will...
Some derms will just...
force feed you.
They'll say, hi, here I am.
Yeah.
Nice to meet you. How much Accutane do you want?
Yeah. It might as well be OTC at that point.
Yeah.
My dermatologist tried two things. I think I did one round of antibiotics and maybe tretinoin before I was like, girl, this isn't working. Like, oh, it was spironolactone and I took 2 pills and I couldn't stop peeing and I was like, let's just get this over with.
Yeah.
Okay. I want it to be done. I don't want to have to do this. in the future. But some derms are much more strict and they make you go through all of the different therapies first. So it really just depends. You'll most likely be prescribed pills to take every single day, and you'll get prescribed a dosage that's based on your body weight. It's based on what's called a cumulative dose, which is the generally accepted dose for your acne to not come back. 0.5 to 1 milligrams per kilogram is the generally recommended dose. But research shows that taking 150 to 220 milligrams per kilogram total gives the best long-term results and the lowest risk of your acne returning. There are online calculators that you can use to check what your dosage would be. And then typically you'll start on a lower dose and then work your way up to what you'll be on for most of your course. So I started out on 40 milligrams a day. The second month I went to 60, and then I was on 80 milligrams for the rest of the time, which I have to note, yesterday I did the little calculator and 220 is like the maximum that you're supposed to hit for your acne to not come back, and I hit 245.
Oh, uninvited.
We it. Yeah.
Wow, it's a lot.
I know. My dermatologist was crazy a little bit. Accutane can also be super expensive if your insurance won't cover it. I think it's like $200 a month if your insurance doesn't. But there are options like GoodRx and some specialty pharmacies that can help reduce the cost. So if you don't have insurance, talk to your dermatologist and see what your options are for getting Accutane subsidized. Most dermatologists will have you do monthly blood panels to check your liver enzymes, since Accutane is metabolized through your liver. My derm literally never had me check my blood.
Really?
I never got a blood test until the end of my course, where I was like, I kind of want to drink alcohol. Like, can you check my liver? And she was like, I guess if you want to. So then I did one blood test at the end of it and confirmed that I was fine.
Oh, interesting. Yeah, I had my blood tested every month.
So it seems like your derm was loosey-goosey about some things. And
yeah. I think they also did a pregnancy test every month on the...
Yes.
Yeah.
So the pregnancy tests are required by law to take every month. If you're somebody who can get pregnant, you'll have to go on 2 different forms of birth control while you're on Accutane.
Or it's been over 10 years probably since I did Accutane, and I still talk about my iPledge, which was abstinence. You can choose one form of birth control if your form is abstinence, but it makes me laugh so hard because you choose abstinence and then there's this warning that pops up that says abstinence is not the best form of birth control. And it's basically like the human mind is feeble and you could slip up at any moment. But it is just so funny. Like that, the first sentence I remember it said was abstinence is not the best form of birth control.
Wait, I forgot that abstinence is an option.
Yeah.
Also,
and you only have to do one if you're on abstinence.
If you're taking abstinence every month, it can be your only form. Yeah, that's right. I forgot about that. I wonder if abstinence is accepted outside of Utah.
I don't know.
If you've done Accutane outside of Utah, will you please weigh in and say whether or not you could choose abstinence? Because it feels like a very Utah form of birth control.
Yeah. I mean, it's possible that other people
could
choose
be.
to do that. And if it's just for like 6 months and you're like not dating someone and you don't want to do like birth control or something.
I think it's like a valid form in quotations. But it's just, it's thrown at us so heavily that I wonder...
If you're not like sexually active, then there's one form that's like non-invasive, but the other ones are like...
It's a lot.
So if you're not choosing abstinence, then you have to like either have something placed inside of your body or take daily pills.
Yeah.
Along with your Accutane.
Yes.
So I wouldn't be surprised if they still allow it, just because it's like, it would be technically easier on your body to just take 6 months off.
Yeah. True.
Be on abstinence for 6 months.
Yeah, take abstinence.
As I'm editing this episode, I wanted to make a quick addition to the abstinence conversation. I think we did an okay job at explaining why abstinence should be an option, but there's still a lot of pushback on allowing this as a single form. So when we get into the conversation of pregnancy, abstinence, and birth control, things can get really sensitive. So I wanted to try to do my best to highlight some of the issues here, especially when it comes to just trying to take an acne medication. I mentioned that there's a warning that states that abstinence is not the best form of birth control. And what I think is actually trying to be communicated by iPledge is that there haven't been very good scientific studies showing that declaring abstinence actually leads
leads to a decrease in pregnancy. Basically, the concept of abstinence is only theoretical, but real-world evidence has shown that it's not very effective. Trigger warning, but one big theme that I haven't really seen anywhere in this conversation is that of consent. I really want to mention that if someone declares 6 months of abstinence and that fails, there is a possibility that that person was pushed outside of their boundaries. And, the risk associated with pregnancy at the time of taking isotretinoin is very high. So we understand trying to take precautions against that, but I think that this is a much bigger issue on sex education in general. Not every patient who decides to take the medication is going to have the same risk associated, but it's also, super hard to navigate what conversations need to happen or are appropriate between a patient and doctor when it comes to things like abstinence, same-sex relationships, and overall patient education. Obviously, this is not our expertise, but I just wanted to add a little extra context to this conversation and kind of just remind you how complex medical ethics can be. But anyway, let's get back into the episode.
Well, speaking of iPledge, there was some drama that surrounded it. iPledge is a REMS, which stands for Risk Evaluation and Mitigation Strategy program. The FDA requires because of the severe birth defects that can happen when you're on Accutane.
Right.
Patients have to register, confirm their 2 forms of birth control, or if they're taking abstinence, and then take monthly pregnancy tests in order to get their prescriptions refilled. In 2021, there was an overhaul to the website, and the update was actually a good thing in theory because it moved from 3 different gender categories, which was female of reproductive potential, female not of reproductive potential, and male. It switched from those to 2 simple ones, which were can get pregnant and cannot get pregnant, which is a win for trans patients who are being misclassified under those 3 categories.
Yes.
But the rollout was a complete disaster. The new website crashed constantly, derms got locked out, and pharmacies couldn't verify the prescriptions, which meant patients couldn't get their medications. The FDA had to call an emergency meeting within a few days, and it caused just like a lot of unnecessary stress and issues for the patients and the derms. The monthly iPledge requirement for patients who can't get pregnant has also been pretty widely criticized. It's like an unnecessary step because it's annoying that they have to fill out the form every single month if they can't get pregnant.
Right.
So dermatologists have been pushing for reforms, and as of late 2023 and early 2024, the FDA was talking about proposing changes. So it's a good example of how it can be a good idea, and in practice, it's maybe not the best thing. Because I think it's super important to keep people educated about how severe the birth defects are from this drug.
Yeah.
And keep you accountable to make sure you are not getting pregnant while you're taking it. But you got to go about it in the proper way.
Yeah. I will say, I don't know if it's changed since I did it, but they do make it very difficult to forget the potential birth defects because they do put in the pamphlet and on the blister package of every individual pill.
I'm like, okay, thank you for
in order to access your pill, you have to puncture through the image. It's
with a red circle on the outside of it. Yeah.
I did it when I was in college and I lived with roommates and stuff, and they'd see them and be like, what is that? That's the craziest birth control I've ever seen in my life.
I mean, it is.
Yeah.
It works. Well, you were taking abstinence at the time.
I was. I said, no, this is not that. I am abstinent. I've taken a pledge. So wild.
I know. Accutane does tend to have a lot of side effects, especially if you're on a high dosage.
Yeah.
Some of the most common ones include dryness or irritation around the eyes, lips, mouth, or nose, joint pain, muscle pain, nausea, increased breakouts. This is the purge phase where it gets worse before it gets better. Redness and irritation, vision changes, lethargy, and I had the crustiest piercings. Did you have that too?
No, because I only had lobe piercings, one set of lobes at the time.
Also abstinent. So that track.
And I didn't really wear earrings. But one thing that I did have happen that is not mentioned here, but I was told was probably a symptom of my Accutane, was ingrown fingernails and toenails.
Oh.
I got so many ingrown fingernails. I remember there was one point in time where I had an ingrown fingernail on every single finger. Some on both sides.
That is horrible.
Yeah, I was like, I just remember every ailment. I felt terrible all the time, and I was like, add it to the list.
Yeah, you kind of become numb at a certain point on your Accutane. I remember when I was in the middle of the purge phase, my eyes were, I couldn't even blink because they were so dry.
Yeah.
I had bloody noses all the time.
Yeah. The only time I've ever gotten a bloody nose was on Accutane.
Yep. Yeah. And if you like put a tissue in your nose, there was always blood on it. Even if it wasn't actively bleeding, like there was always blood.
It was ready. Like
and I had a full face of acne because I was in the middle of the purge. And I just remember I was like, I mean, it can't get any worse. My joints didn't work because it was bone on bone. Like there's no synovial fluid. I couldn't go in the sun. I couldn't drink alcohol to drink the pain away.
Yeah. I think I've mentioned this on the podcast as well, but I remember I got in a hot tub one time.
Mm-hmm.
I truly, my skin hardened.
Turned into a little beetle.
I have never experienced anything quite like it. Unfortunately, the hard drive of my memories from that time, like all my pictures it got corrupted. I don't have any of them. Because I'm sure I took pictures of it, but
maybe it was for your own good.
Maybe.
It's like, let's just block out this time of our life. Because, I have so many pictures of Accutane. I actually kept a whole Accutane journal in my notes app. So I have like everything I was feeling, everything that was happening to me listed. I'll probably make some TikToks about my whole Accutane journey. But yeah, it is brutal. We're not going to sugarcoat it.
Mm-mm.
But not everyone gets all of the side effects. And there are also tons of side effects that I didn't mention that some people get. It just depends on you.
Yeah. And you don't, I mean, because your acne doesn't ever come back, some of the side effects don't ever like fully go away, if that makes sense.
Oh, yeah. My eyes are permanently dry.
Yeah. I used to have oily skin. Now I have dry skin. Mm-hmm. And just, I don't know. I feel much drier than I ever did before.
But there are some benefits. For example, one thing I really miss about being on Accutane is you never have to wash your hair.
Nope. I would go 2 weeks without washing my hair.
Your scalp does not get oily. And it's not gross that you're not washing your hair because there's no sebum.
Yeah.
So your hair just looks phenomenal all the time. I mean, not necessarily the ends of it because you like really have to
condition.
Keep up on conditioning and stuff. But I miss that so much. Now I get greasy hair again. And I'm like, should I low-key microdose Accutane so that I can?
I know. I wonder if there's like a vitamin A scalp serum.
Maybe. I will say though, a lot of people do microdose acne. Okay, if you're microdosing acne, you gotta stop.
Ew.
They're acne maxing. No, a lot of people microdose Accutane. A lot of celebrities microdose Accutane. So they'll just take a few pills every week. It's basically just a permanent maintenance dose instead of having to go through 6 months of hell.
Yeah.
Because that would be really hard on their careers and stuff if they did that. So microdosing Accutane is an option.
Interesting.
But unfortunately, it just is hard on your body and you do have those side effects. So you kind of have to decide what you're willing to give up and whatever. But yeah kind of interesting if they do that. So we alluded to it earlier, but we're not really sure why Accutane doesn't cure acne 100% of the time. But it does seem like remission correlates with hitting your cumulative dose. So if you hit that amount that we talked about earlier, you're much less likely to relapse and get acne again. Like we mentioned, that range is 120 to 220 milligrams per kilogram. So if you hit that, you're less likely to get it again. And I hit way over that threshold. So if I ever see another pimple on my face, I'm getting a refund. The actual mechanism behind permanently getting rid of your acne isn't clear. Like the mechanism in general isn't clear. But your sebaceous glands aren't shrunken forever, but some people never get acne again. So the best guess is just that hitting that threshold causes enough sustained suppression over the rest of your life that the cycle never restarts itself. But
interesting.
We aren't positive.
Interesting.
Now, what I want to leave listeners with, my biggest thing about Accutane, is that you do not need to be scared of taking Accutane if it's something that you and your dermatologist think is right for you.
Yeah.
I didn't go on Accutane until I was 23 years old, and a huge reason for that is because I would read so many horror stories on Reddit and got told that there were permanent side effects or really scary things that would happen to me if I went on Accutane. I remember I was specifically scared that it was going to cause infertility. So there was a huge mental struggle that I was having with wanting my acne to get better and feeling such low confidence having acne, but also not wanting to permanently maim my body.
Yeah.
And that's why I waited so long. And the jury's still out on my fertility, but I don't deal with any horrible, debilitating side effects. And I've never had any depression or ideations while I was on Accutane or after. If anything, my confidence is so much better now that I went on Accutane. So it changed my life, and my only regret was not doing it sooner. I wish that I had not waited as long as I did.
Yeah. We talked about in last week's episode, looks maxing, a little bit about how, unfortunately, we do live in a society that does value your appearance. And it can be just really difficult to not be confident in your own skin, especially when it's something that, I don't know, acne is obviously extremely misunderstood. There's a lot of stigma behind people that do have acne, that they are not healthy people and they don't take care of their skin, or they have bad hygiene practices, which is just not the case. A lot of it is just biological. That can be a really hard thing to live with when there's a lot of assumptions made about you.
Acne can also be physically painful too. Certain types of acne, like you can get really painful cysts, or, you know, your pimples can pop and you can be bleeding. Like, it's just a mentally and physically painful experience.
Yeah.
And Accutane is available if you want it to hopefully help get rid of that.
Yeah.
And we're not sponsored by Big Accutane, okay?
No.
Like, we don't have any incentive to tell you to go on it. I'm not a doctor. I just don't want people to be scared of it like I was, because I could have saved so much suffering if I had just done it earlier.
Yeah. Maybe the flip side of that, to just argue the other point, is you are someone who was very, very good about like having a routine and taking care of your skin. I was not necessarily that way. I'm still not necessarily that way. I've been using a topical retinoid and I've seen a huge improvement in my skin over the last, I've been doing it now for 6 weeks and I've seen a huge improvement. I don't know if it's the topical retinoid. It could just be having a good skincare routine. I do think, I mean, I literally just said that there's stigma around acne and not having a good routine. And I think a lot of the people that do have bad acne do try to, like...
Yeah, they usually have skincare routines.
Yeah, the time that I was the most about my skincare routine was it always corresponds to when my skin looks the worst.
Yep.
But there are less invasive and less permanent ways to address skin issues. So I do think, like, for me personally, I don't necessarily regret it. Maybe I will if I find out that there's some long-term effect that I don't know about yet. I guess I don't have the same regret of like, I wish I had done it sooner, because I did it when I was 19 and I tried Proactive, you know, when I was 15, you know, like I didn't have that much time between like puberty and the time that I started taking Accutane. So for like younger listeners and stuff, obviously there's a range of skin issues and a range of how bad your acne is. There's a list of, you know, hundreds of different things that you could try. I think it's just finding the time that feels best for you personally and not letting too many other people get in your head about when is specifically the right time to do it. You shouldn't rush into it, but you also shouldn't be afraid to do it, because a lot of people have done it and they've been really, really happy with the way that their skin has turned out. So
yeah, definitely. I guess I should also mention, I do wish I had gone on Accutane sooner, but hindsight is 2020. And
we gotta look like prophets.
I told you I look like Jesus.
Okay, sorry.
I did so much skincare. I used Differin. I was going to an esthetician for months to play whack-a-mole with my zits. Like, I really did try so many things before going on Accutane. And so I guess it is easy for me to say, like, I wish I'd gone on it sooner, but I also wouldn't have known that nothing else would work for me until I got to the point where I was like, I'm so done having acne that won't go away. Like, I just need to do it. So yeah, I do think if you have acne, probably try other things first, because there are plenty of topicals that can help manage acne and help it go away if you're consistent with it. But if you are like me and you've tried literally everything and you're like, I just don't see an end in sight for my acne, Accutane might be a good choice for you.
Definitely.
So
I agree.
Can talk to your dermatologist about it and hopefully it goes well.
Hopefully, yeah.
Yes.
Well, thank you so much. That's so helpful. All of that
course.
background.
Yeah,
Very
I felt like it was
interesting.
time to fully flesh out Accutane.
Yeah. And honestly, I loved your recap of the iPledge stuff, because iPledge does feel kind of like a fever dream to me. Again, it was like over 10 years ago that I did it. So I don't know. There are parts of it that I'm like, is that real?
Yeah, I think everyone who's been on Accutane can kind of trauma bond over the annoying iPledge process.
Yeah. Well, with that being said, I think I need to get more oils in me.
Via food?
Via, sandwich.
Yes.
So let's call that a day. Why don't we? Let's what would be the word? Let's put a pimple patch on this episode. Let's cover it up.
Yep. Let's wrap it up.
Yeah. Well, I don't know.
Basically, what we're trying to say is thank you so much for listening today. You can find our website, beautyexspeaker.com, where we have all of our show notes and resources. You can find us on social media at beautyexspeaker everywhere. My personal social media is at SadieBXB.
And I am Nat BXB.
So you can go over there to see what we're up to.
Also, if you're listening, please follow along. Go follow us on whatever platform you're listening to or on other platforms that you're not listening on. Go follow because we have a lot of listeners that don't follow the show. So
yeah. Which, thank you so much for listening, but also please just hit the subscribe button. It helps us so much.
It helps us.
Like this episode and share it with someone in your life who has also been personally victimized by acne.
Or is thinking about being personally victimized by acne. Who's considering being...
Like, you know what I'm missing in my life is some pimples.
Oh, sorry. Accutane. Who's looking to be personally victimized by Accutane.
Who's currently victimized by acne and who wants to be victimized by Accutane.
Perfect.
Yes, there you go.
Yeah.
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 Thanks again for tuning in and we'll see you guys next week.
All right. Bye.
Bye.